Regulatory Science, or TCORS. This is Hannah Eisner. I'm the director of the Tobacco Regulatory Science program at NIH. Before we get started, I just want to mention a couple of things about the webinar. First, very important, everyone who's participating in this webinar other than the presenters is muted. So if you want to ask questions in the Q&A period, you will have to type those questions into the Q section on the webinar landing page. Also, we are recording the webinar, so you'll be able to hear it again if you wish, and have access to the slides, which you will be able to find on the TRIS web, and I'll give you them. I think the website, is it on? Not written there. We'll give you the website in just a moment. Also, if you have any difficulties hearing or anything like that, you can also email the TRIS mailbox if you're unable to type your question in to the website. So I think that's all the housekeeping, and we can move on to this. Do you have to switch the? Yeah, we're coming. Okay. One thing I wanted to point out right away is the fact that you'll note on this first slide that the RFA number is 017-006. We actually had to reissue the RFA on Friday. The previous number was 003. Unfortunately, when the RFA was published, the text for the significance criterion was omitted in when it was actually came out in the publication, and so we had to reissue the FOA in order to include that missing information. But other than that, there's nothing changed in it, so except for the number. So just don't be confused by that. Like most of the people on the phone are probably familiar with TRIS, but for those who may be new, I'm just going to briefly do a little bit about who we are and how the program operates. So the program emerged as a result of the partnership between FDA Center for Tobacco Products and the NIH, and it was assigned to the Office of Disease Prevention, so that's where TRIS is located, and that's central to NIH. It's in the Office of the NIH Director. As such, we serve as the primary liaison with the Center for Tobacco Products, but also work across the NIH with all the participating institutes and centers to coordinate FOAs and grantee meetings and other activities. I also always like to mention that TRIS represents an addition to the NIH Tobacco Research Program. I'm sure that many of you are familiar with the decades of research that NIH institutes and centers have supported over the years in tobacco control. And TRIS does not replace or diminish any research activities that are being conducted by the institutions. Our web page, prevention.nih.gov/tobacco. And I recommend that you check this website from time to time. We do announce all funding opportunities here. We also have the entire CTP portfolio that's supported through the NIH. All the grantees you can find on the research portfolio section of the website, so that will give you a very good indication of the types of projects that are being funded. For today's agenda, we'll first be hearing from Dr. Kathy Backinger from the Center for Tobacco Products, and some background on FDA and the Tobacco Control Act. It will then be followed by KD for discussing the component of the application. Then we're hearing from our scientific review officer, Dr. Boris Sokolov, and then from the grants management team at CI, Carol Perry and Swan McKeith here will be talking about some fiscal issues to keep in mind. And then we will, after the presentations, open it up for questions and answers. You know, some questions that have come in already, but please feel free to add to those and so without further ado, Kathy, I'll turn it over to you.
Let me get slides up. Thank you. Sorry, I need to advance it. Good afternoon, everybody, and I'm going to briefly kind of talk through a little bit about how we use our research at FDA to inform our regulatory actions. And as Helen said, I know some of you, or many of you, have heard this already, so I will be brief. But I think most people know that we've had authority to regulate tobacco products since 2009, and at that time that included cigarette, tobacco, roll your own, and smokeless. And then just recently, a few months ago, August 8th to be exact, the deeming rule went into effect, where basically we were able to assert our jurisdiction over all the other tobacco products that meet the statutory definition of tobacco. And I won't read all these, but I think everyone, you know, now we can look at the whole breadth of all the tobacco products that are out there, either now or in the future, that then fall within our jurisdiction. So what does tobacco regulatory science actually mean? I think for many of you on the phone, and I don't know who else on the phone, you're used to applying to NIH for grants, and NIH's mission is a little bit different than FDA's because it's more of a subset of tobacco research, but we need to understand, you know, science that will be able to inform specific regulatory questions. And what it means is rather than generating general scientific knowledge, we want to take the knowledge to have and translate it into specific scientific findings that can inform our decisions and actions. And so a little distinct because we need to look at what can we do as an agency that would improve the public health. And FDA's mission, or CTP's mission, excuse me, is to decrease the morbidity and mortality caused by tobacco use. So what I want to do probably for the bulk of my presentation today is just kind of talk through, and this will, hopefully will help you think about how tobacco regulatory science is different than perhaps some of the science that you're used to doing. So in general, we do four things at CTP. We do product standards, we do product review, we do compliance, and public education. So I'm going to walk through each four of these to talk about the science that can be generated that can inform each of these specific areas. First, I'm going to start with product standards. Everybody who has, I'm sure you've all read the Act back to back, hundreds of pages, but in Section 907 gives us the authority to adopt product standards that's appropriate for the protection of public health. And in the interest of time, I'm not going to read these, but you can see that we have wide authorities to set a product standard, whether it's for a component or a constituent within a tobacco product, how we measure, test those, restricting on sales and distribution, and changing the form and content of labeling, just as an example. So when we think about product standards, we think about, okay, so what do we have to understand? What are the questions? So in thinking about protection of the public health, we have to understand the risks and benefits to the population as a whole. And as I go through these, again, these are for you to think about what questions or research projects that you may think about proposing as part of your TCORS projects. We also have to think about the increase and decrease likelihood that existing users of tobacco products will stop using products, and then what is the increase or decrease likelihood that those that don't use tobacco products will start using them. So to decision points and questions that could inform a product standard. And I should back up just to say that we can't discuss publicly the product standards that we as an agency are thinking about or that we're working on or considering, because it could change the financial markets, and that is a prohibited act. And I don't want to lose my job, and I don't think anybody else does either. So we can't talk about it. So some of this is kind of guessing, what's going to be most appropriate for the public health. But when you think about a research question, what product standard could you possibly come up with that you could justify in relation to public health? What's appropriate? It has to be unambiguous. It has to be specific and measurable. We can't just say, let's just lower X constituent in a tobacco product. The question is, why that constituent? Why that level? What happens if it's at different levels? So, to answer that, it has relevant to the situation. We have to understand if there's going to be a specific level. Again, just using constituents as an example, not to read anything into that, but just as an example, why that level and what would happen if it were above that level or below that level. So we need the science to surround all that would be most informative. So moving on to product review, I think most people who have been around FDA and CTP and TRIS now, understand that all tobacco products have to have a marketing authorization from FDA in order to be on the market, and there's different pathways. Again, in the interest of time, I won't get into all the pathways, but each tobacco company that wants to have their product on the market has to submit an application to us, and then we use the scientific evidence and the research that's both provided by the applicant, but other research and science is out there to inform our review of that application and then help us determine whether that it will receive a marketing order. For a pre-market tobacco application, the question, and this is outlined in the Tobacco Control Act, but I think I'm going to read each one of these because I think there is a difference, and I just want people to understand. For a pre-market tobacco application, the question that we have to answer is whether marketing that new product is appropriate for the protection of public health. C, which is substantial equivalence, which means that a company may have a new product and they are comparing it to a grandfathered or predicate product that's already been on the market since March of 2000, I'm going to get the date wrong off the top of my head. I think it's 2000. No, it couldn't be 2009. Okay, never mind. I can't remember off the top of my head. But the differences between a new product and the predicate product is a different question of public health. So it's different from PMTA. And then for a modified risk tobacco product, the question we have to answer is, will the product, as it is actually used by consumers, significantly reduce the harm and risk of tobacco-related disease to individual tobacco users and benefit the health of the population as a whole? The questions are outlined in the Act, and those are the questions we have to answer when we're reviewing a tobacco product application using one of those pathways. And I'll with the date of the predicate if I can get my allergy fogged brain back into gear, but I'll get to that in a minute. Okay, so when we look at a product, what things that we have to consider? So the application, since the applicant submits all kinds of information such as materials, ingredients, and again, I won't read all of these, but basically everything that makes up that product as well as marketing. And then also have to look at the impact that product has on appeal, for example, addictiveness, the exposure, toxicity, initiation, and cessation. And then we've got to take all that as an agency and translate that in understanding what the impact would be on morbidity and mortality. You can see that it can be quite complex, and we have to kind all of the different information from the different scientific disciplines. Also, moving on to compliance and enforcement. One thing that we have also authority in the Act is that we are responsible for implementing and enforcing the provisions in the Act. And what that means is that we go out and monitor the industry for compliance. So we can go into manufacturing facilities and do inspections. We can go into retailers, so local convenience stores, to make sure that they're following sales to minors. We can inspect and do surveillance on importers. So that we can do that because we're tasked with enforcing the actions. And we can do violations if we find dues. Move forward? No. Oh, sorry. So just a lot of this isn't necessarily germane to, I guess, research, but I just wanted to make sure that people know that also part of our lens is look at adulterated products. And you'll see the very last one is that we can go in, a product is considered adulterated if it's in violation of modified risk claim restrictions. So companies can't make a claim that their product is modified risk with first getting a marketing order from us, an authorization. So research could be informative around if there are products making modified risk claims. And we also have authorities under misbranded products. And just looking at the top bullet as an example, we can do a violation. A product has false or misleading labeling and advertising, and I think one perhaps recent example is with a natural spirit where we set letters to them because they were using the terms 100% additive free and 100% natural, and found that they were in violation of the act. So as far as research, having data that would support compliant actions are strongest if they're specific to a specific case or product. But also, generalized research can be informative, that can supplement the evidence from our I just got a little confused because someone handed me the note. The date of the predicate is February 15, 2007. I was on the right track, and then I stopped myself. I don't know why I did that. February 15, 2007. So this will be great if anybody listens to this after the fact when I messed up, but that's okay. I'm on my allergies. Okay, moving on. So just again, research can inform, help, generalized research can supplement evidence that we could use when we're looking at compliance and enforcement. The last section is around public education. I think many people are familiar with FDA's public education campaigns. So it is in the Act that we can and should educate the public on the health effects of tobacco products, and we've got a number of campaigns that are out there, both media campaigns, campaigns on the web looking at risk youth, looking at multicultural youth, and looking at rural youth who would use smokeless tobacco, and then the LGBT young adult community. So thinking about how science and research can inform public education, it's helpful for us to understand, to help identify misperceptions around among users and non-users. What are the appropriate and the best approaches of communication to reach certain segments of the population? What are the messages? What are the right way to frame messages to reach vulnerable populations? What are the right, testing around promoting behavior change, and then making sure that it's in a format that the public can understand? So now move on to what's in the RFA and just talk about the domain. So I just went over the 4 areas that FDA or CTP could use science to inform our regulatory action. So in the RFA, I think if everyone's read that, we have 7 scientific domains, and I'm not going to read each one of these, but I just want people to understand that this TCORS runs the breadth and gamut of the science, the scientific areas that could inform tobacco product regulatory activities. So toxicity, specifically looking at novel alternative toxicological, looking at addiction, what are the characteristics of different tobacco products and effects on addiction, and and abuse liability. Health effects, understanding short and long-term health effects, particularly cardiovascular and respiratory health effects, including inflammation. Areas include, well, let me move on to that. How come this isn't moving forward? Oh, behavior. So understanding knowledge, attitudes, and behaviors related to the different tobacco products and how knowledge, attitudes, and behavior changes with different changes in tobacco products. We just talked about this in public education, but how can we effectively communicate to the public and vulnerable populations regarding nicotine and the health effects of tobacco products? And it's not just media campaigns, it's all different ways to educate the public. Marketing, understanding why people become susceptible to using tobacco products. So, and it's both in a class of tobacco products, like, for example, smokeless as a class or e-cigarettes as a class, but also products within classes and all the different transitions. And research to help understand what is the impact of potential regulatory actions. I mean, one example in this area is modeling to understand if we were to take an action in an area, what reasonably be assumed as the impact on the population. Now, I wanted to also just, in my last couple of minutes, talk about what do we mean by a characteristic. We outline this in the RFA too. So a characteristic pretty much encompasses everything that's in a tobacco product. That's the materials, that's the ingredients, including if there's additives there or flavors, the design of the product, the composition, the heat source, features that could include harmful and potentially harmful characteristics. All of these can be embedded or incorporated into those 7 previous domains that I just mentioned. And to mention, this is also outlined in the RFA, some of the areas that we are deeming non-responsive. I should point out it doesn't mean that they are not relevant or appropriate to our regulatory authorities. It just, for this RFA, we wanted to have a little bit more of a narrow focus than we had with the original RFA that we released 5 years ago, because, you know, we've learned a lot in the last 5 years, so we wanted to kind of narrow the focus. So again, it's not to say that these, and I'm not going to read each one of them, you may have questions about it, but just to say that it's not that they're not relevant or appropriate, but for this RFA, we wanted to limit some of the research ideas that were coming in from your applications. So just to end now, I think Dana actually showed this or something like this in the Castle presentation earlier today, but we have a lot of different scientists that we need to bring to bear to all aspects of our tobacco regulatory science portfolio and how that science then builds the space and helps inform our regulatory action all the way from the product and all those parts, the user, and then the population as a whole. So lastly, just in summary, when you're thinking about projects that you may consider as part of your TCORS application, please be specific. Think about what are the characteristics of product, what's the population that you're studying, and what are the impacts that you're researching on the population health. And make sure that it's measurable and that you're also considering evaluating other potential variables within that research question. I'll end. Thank you. And now that's my newest grandchild, but it's not, because now we have 4. That's the third. I know, right? Thank you.
Thank you, Kathy. So now I'm going to turn it over to Dr. Kay Ronke, who's going to be talking to you about the components of RA and what's required.
Excellent, and thanks, Kathy. You did a good job of setting the stage for the research. And so now I'm going to be talking about the elements or the components of the application itself. So keep in mind that what I'm going to cover is not comprehensive. So please read the RFA. I'm just going to be covering the highlights here. Note the mechanism is a U54. So this is one of the ways that the current TCORS is different from our previous round. So now we're going to have cooperative agreements as opposed to the P50s. And broadly, the purpose of the Tobacco Centers of Regulatory Science are to establish the scientific foundation for regulatory and policy issues, as Kathy said, so that it will inform the work of the FDA Center for Tobacco Products, seeking to build the research capacity and scientific expertise in order to inform these areas. And we're looking to ensure both a stable, ongoing research enterprise and a flexible, responsive, and collaborative resource. So again, that helps explain the cooperative agreement mechanism, and will make the next that we discuss a little bit more illuminated. So I'm going to describe the TCORS components. Another of the ways that this round is different is we have an electronic application. So for those of you that might have submitted an application to this round, we had paper application. So these components correspond to the electronic or modules, you might say, of the application. There's an overall component, and they'll include a description of the integrative theme, a minimum of 3 research projects, an administrative core that will have the rapid response projects component, and a career enhancement core. Now, all those are required components. There's also the potential to add optional cores if they're justified and appropriate for your application. So just describe each of those components briefly and again touch on the highlights. The first one is the overall component. And in that component, you'll be describing, in addition to the overall goals of the center, describing each of the pieces of your projects and your different cores. You'll also be describing your integrative theme. And so this is important. The expectation that we have is that the whole of your center is greater than the sum of the parts. And we'd like you to characterize that by describing an integrative theme that characterizes your center. This could be a unifying goal. It could be a targeted area of research, or it could be your expertise, your specialization, what you bring to bear on that building research capacity and scientific expertise goal that we have. So again, you have a little bit of leeway in deciding what your integrative theme is, the way that you are going to put forward your center and describe it. It could be broad, it could be focused. It could be organized around a variety of different topics, so you could pick one. And examples could be a research need or gap that you're looking to fulfill with your research. It could be a specific population that your center is focusing on. It could be the products or constituents that you're taking a deeper dive into examining, or it could be a scientific domain. The scientific domains are what Katie described in her presentation. Again, I'm not going to restate those scientific domains here, but they include toxicity, addiction, health effects, behavior, communications, marketing, influence, impact analysis. So be sure to read the RFA. Those scientific domains have additional scientific priorities that are listed as examples. But again, these scientific domains, the requirement is that your application must address no less than 2 of those 7 domains across all 3 research projects. Now, any single project could address 1 scientific domain, but collectively the application must have 2 or more, and we'd like you to make those explicit in your application. So keep in mind that even though there are 7 lists, addressing many scientific domains or all scientific domains is not advantageous. We're really hoping that you have a focused center. And again, make explicit what you're going to be addressing, both within each research project and that overall component, describing which domains your center is going to be addressing. So each research projects will have a separate component within the application. Again, those are the components is what's described in Part 2, Section 4 of the application. You're required that you have 3 or more multidisciplinary research projects within your application. Really developed R01 level projects. So again, these are R01 comparable projects. Each project and each specific aim within the projects must fall within the regulatory authority of the FDA CTP. So I say here just to encourage you all to keep in mind that not only must your application address those 7 scientific domains, 1 or more, or each research project addressing 1 or more, each specific aim should be addressing something that falls within FDA regulatory authority. Many of you are very familiar with what that means. For those of you who aren't familiar with what that means, that requirement for remaining within the regulatory authority, please speak with a program official, one of the scientific or research contacts on the RFA, because your application could be deemed non-responsive if you fall outside of FDA's regulatory authority. We really recommend that within the application you articulate how your research will be informing RFA priorities and tobacco regulation. Okay, next component is the administrative core, another required component, and the objectives are to monitor and facilitate the center objectives, provide oversight and quality control, promote an atmosphere of collaboration, and again, we require that there is a budget aside for rapid response projects. And to a little bit more about that, begin year 2 and all the way through to year 5, we ask that the application set aside $200,000 direct cost per year in order to be able to respond to time-sensitive research topics. So these will be annual activities. The topics will be identified by the FDA, NIH, and the TCORS steering committee. That said, given that those topics will be identified each year, please don't propose your research projects in the application, because you won't know until year 2 what those first set of sensitive research topics are going to be. Now, you're welcome to describe a process for soliciting the projects, assessing and prioritizing them within your center, or addressing the capacity that you have to respond to a broad set of scientific topics or expertise that you have that might to bear on time-sensitive research projects. But again, don't propose your specific response projects in the application. Okay, component is the career enhancement core, another of our required components. And objectives are to enhance the development of tobacco regulatory science research expertise of investigators at different stages of their career. This could span from students, whether it's doctoral, postdoctoral, new and early stage investigators. It could be more established investigators who are new to tobacco regulatory science. The goal really is to enhance that research expertise. In the career enhancement core is the inclusion of any career enhancement pilot project plans. Again, these might be seed money to help establish research projects for the individuals who will be, careers might be enhanced. I'm going to take to, this is one of the ways that the language is different from the previous TCORS program. If you'll recall, we had a training component. That's one of the things that's changed is that the NIH, given the way that the NIH tracks their training programs, they use the word training program and as well as education program to define a very specific type of program. So that term, training program and education program, are really reserved for different grant mechanisms. So what was in the previous TCORS, now what is solicited in this application is rise to the level of what the NIH now calls a training program, and that's why we're calling it a career enhancement course. So be sure to look at the requirements in this RFA for this component and to make sure that what you're proposing really is consistent with the goals that we have for this component. And if you have any other questions, again, feel free to reach out and talk about that. Some of the expected features of the TCORS. We are looking for centers that are open to collaboration, both within a single TCORS, across their research projects, and across the different centers, including the career enhancement activities. We would like to identify common measures and protocols where they're feasible, and also like the centers to be open to addressing those ongoing scientific issues, those time-sensitive research projects of the FDA Center for Tobacco Products. Critical to keep in mind is that there are many pieces of your application that will determine whether or not it's responsive. Applications that are not responsive will not be reviewed. So it's very important that you ensure that you not only include the required pieces, but you don't go beyond them. For example, what I was talking about, ensuring that your specific aims all fall within FDA's regulatory authority. here are some of those aspects of the application that contribute to a determination of responsiveness. Again, identification of an overall integrative theme, a program of research that addresses no less than 2 of the 7 scientific domains that are listed in the RFA. Specific aims across all the research projects must fall within the scope regulatory authority of the FDA's CTP, and no aim may address the non-responsive research topics that are outlined in the RFA and that Kathy outlined in her presentation. As such, it is strongly recommended, and I can't say this enough, please do research and your specific aims with a scientific and research contact from the institute relevant to your research. Again, it's really important to have those conversations early. Don't wait until near the time of submission. I also ask that you make explicit the integrative theme and the scientific domains, both with your letter of intent and within your application, to ensure that we can give you feedback in the letter of intent and within your application, again, to make sure that we can determine its responsiveness. We encourage you to submit a letter of intent early to allow time for feedback. If not, please contact us early. More is available in our FAQ document. Please see our frequently asked questions. It's already up on the website, and we will continue to update it as new questions are asked, so be sure to check back regularly. Letter of intent, not required, but we really strongly recommend it. There's the required information from RFA, including the descriptive title, the names and institution of key personnel. We also encourage you to include your specific aims, your integrative theme, and your scientific domains, so that we can give you any feedback if we think you might be going off course. Again, give us a call. Feel free to contact more than one person on this list, but always start with the person whose research the institute matches the content of your research. They'd be able to give you the most targeted feedback. We're all happy to talk with you. Thank you.
Okay. I see we're getting a lot of questions already are coming in, but I'm going to hold them until we're finished with all the presentations. So now I'm going to turn it over to Dr. Boris Sokolov, who is a scientific review officer for this FOA.
Good afternoon, and I'd like to touch upon a few issues which are important to keep in mind when you prepare and submit your application, and which may have significant on the results of the review. The applications are due on July 19, 2017, and scientific review meeting is planned on January 2018, and advisory council reviews will be in May and some in June. Well, again, due on July 19th, please make sure that you make all effort to submit before July 19th, because if, for example, you have continuous submission privileges, these privileges do not apply for this RFA. So if you're eligible for continuous submission and you're able to submit normally, most of your R1s, R21s, anytime you want to submit them, this doesn't apply for the current RFA. You will only be eligible for a 2 weeks extension beyond the July 19th submission. And 2-week window of consideration for late submission may be applied in some other cases, such as death or severe illness of the PI, or recent study section service. However, even in these cases, no advance permission may be given for late applications. It will be decided at the time when you submit it, except maybe for recent study section service. If you served within 2 months of the application due date, 2 months before that or after that, you will be eligible for week submission. It's not guaranteed, but it never happened before that it would be not, the request wouldn't be honored. And please also keep in mind that in these applications, not at the last day of the submission date, but 1 or 2 days before, because problems such as problems with your computer system computer system in your institution or system-to-system submission service or illness of the person who's supposed to submit your application will not be considered a justification for late submission. Submissions must be completed at the time of submission. No changes can be made after submission. No errors can be corrected. And we cannot accept post-submission supplemental materials except for those that derive from unforeseen circumstances, such as death or departure of an investigator. In that case, we may accept modified budget pages or NIH bias sketches, but no changes to the scientific content of the application can be made, and no other kind of errors can be corrected. You can also accept notes of acceptance of a manuscript. However, any allowable post-submission supplemental materials which are very limited. Any of those supplemental materials must be submitted not later than 30 days to the meeting, and they must be submitted or approved by in writing by a grant signing official, otherwise they will not be accepted. And also it's useful to keep in mind that reviewers, although we ask reviewers to read supplemental materials, the reviewers are not obligated to read them, and sometimes it's technically almost impossible. We make all efforts to avoid any real or perceived conflicts, and you may be aware of some conflicts we cannot identify by ourselves. Those may be personal conflicts or long-standing scientific differences. And if you have any of those, we're asking you to inform us at the time of submission in your cover letter. So when your application arrives, we will have a chance to take a look at your request and take appropriate actions if it's needed. And please do not wait until you see the roster, because it may be way too late to make any reasonable actions to correct the situation. We will exclude from the review process anyone who is involved in any of the applications in any significant role, including consultants. And we will exclude also people from the tobacco industry. From the review of a specific applications, not from entire review process, but from review of a specific application, we will exclude all collaborators and former collaborators within the last 3 years of any of the investigators who are involved in that particular application. We will also exclude all mentors and mentees in 10 years, at least within the last 10 years, and sometimes forever, of anybody who is involved in your application, including consultants. And you have collaborators and consultants from 10 different institutions. Nobody from those 10 institutions will be allowed to review your applications. So please make sure that when you include collaborators in your applications, they have a well justified role, and it would not create later problems with finding appropriate reviewers. Well, we have 5 scored review criteria, and on the surface, they are the same as for most other NIH applications: significance, investigator, innovation, approach, and environment. But that may be a little bit confusing, and please read the RFA very carefully, because what is meant by significance and innovation in the RFA is slightly different from standard definition of significance and innovation. For example, when evaluating significance, the reviewers will ask the questions: how will successful completion of the aims affect the concepts, methods, and technologies related to the manufacture, distribution, marketing of tobacco products? And when they evaluate innovation, they will ask the question: does application challenge and seek to shift current research in the field of tobacco science? as it relates to the manufacture, distribution, and marketing of tobacco products, and whether it advances knowledge base that informs manufacture, distribution, and marketing of tobacco products in order to protect public health. So please keep that in mind, and we will make significant efforts to train the reviewers and provide them with appropriate guidance and to make sure that they apply these criteria exactly as they written in the RFA. So if your application helps to reviewers to answer the questions under RFA, this will be very helpful for the review and then of the day to your outcome of your application. Well, and we have some additional review criteria for this RFA. This review criteria will not be given individual scores, but they will be considered in the review and they will influence the overall evaluation of your application and the overall impact score which will be assigned to your application. And the reviewers will be asked to evaluate center coordination and synergy, research potential to inform regulatory decision making, and career enhancement plan. These RFA specific questions, the reviewers will evaluate standard aspects of all NIH applications, including protection of human subjects, vertebrate animals, biohazards, resource sharing plans, and authentication of key biological and chemical resources. Please do not estimate the significance of these criteria because particularly protection for human subjects and vertebrate animals may dramatically influence the overall evaluation of the impact of your application. As a disclosure, I touch on just a few regulatory issues, and you have find the whole set of the policies which are applicable for this RFA, and read those policies and see aspects of those policies. I didn't have time to discuss them, all of them. If you have any difficulties in interpretation of policies, please feel free to contact me anytime. My contact information is in the RFA. And it's better to start with email, so I would be aware first what your question is, and we discuss it over the phone.
Thanks, Boris. And now we'll be hearing from Carol Perry and Tawana McKeever at the Grants Management.
Okay, hello everyone. We're down to the award information. Good stuff. Okay, so with this particular RFA, we are going to fund up to 10 TCORS from support from the CTP. It's going to total $40 million for fiscal year 2018. The U54 Center will not exceed $4 million in total cost per year. That's total cost per year. Applicants may request a project period up to 5 years. And this piece right here with the foreign institution gets a little tricky, but the non-domestic entities, non-U.S. or foreign institutions are not eligible to apply. Also, non-domestic components of U.S. organizations are eligible to apply, but foreign components are eligible to apply. So it's really nice when you actually press the link that's in this particular slide, you're able to go to where it breaks out foreign components, foreign organizations, and foreign public entities. And it gives you exactly what it is that I'm sure you're going to need to understand if you have this particular piece, if you have a foreign component piece. Okay. As Dr. Wonke said, the letter of intent is due 60 days prior to the application due date, which is May 19th. Electronic application submissions are required. No, all submissions will be through NIH Assist, and no paper applications will be accepted. The possible start date will be July 2018, and awards will include a term and condition requiring a separate in-progress report every 6 months, and even during the no-cost extension period, if your application is approved.
I'm just going to continue with some things to remember. And I do want to reiterate that please read through the entire FA, or this RFA. Please read through it so you are mindful of the dates and all the requirements that are included in the announcement. And just be reminded that, please be reminded that the applications are due by July 19th. However, early submission will begin on June 19th of this year. Again, the funding instrument that we're using is the U-Force, a cooperative agreement, so that involves that has programmatic involvement, and you will not be able to, will have automatic carryover authority, and it will not be a part of the SNAP population. Also, if your application is selected for funding, please submit that just-in-time information as early as possible. IRB, IACUC approvals, these are types of things that will delay or hold up an award. And being that to award these in July of 2018, that's in our fourth quarter, which is a critical time of the year for us in the Office of Grants Administration. We do 50% of our work during that time, and so it's critical that we get these documents in early or on time if your application is selected for funding, so that we can issue the awards as soon as possible. Also, if you have any questions, you contact information, you may feel free to contact me or Tawana. And I think the next slide shows our email and our phone numbers. And that's all we have.
Great, thank you very much. Okay, so now we will go into our question and answer period. We've already received a lot of questions, and you can keep them coming. Hopefully we'll have enough time to answer all of them. So the first question is, the RFA requires plans for career enhancement pilot projects for trainees. So the question is, do separate screening evaluation mechanisms for these trainee pilots in the career enhancement course, or can this be separate components alongside the rapid response projects in the administrative course? We anticipate similar screening mechanisms for the rapid response projects and the trainee pilots, and feel would fit better into the administrative core. Additionally, do the budgets for these trainee pilots need to go into the career enhancement core, or can they be a part of the administrative core? So a long question about basically trying to distinguish between what we're talking about, which is new in this RFA, about rapid response projects, the pilot projects that are in the career enhancement core. Rapid response projects are new, and as came in, they're going to be from years 2 to years 5, and require set aside. However, topics and how those pilot projects or rapid response projects evolve, there's going to be input from FDA and NIH. Before the pilot projects that TCORS were conducting, were pretty much the ideas were generated from the TCORS. It allows a mechanism where FDA, in fact, can get a quicker response for some time-sensitive projects. So that's what the rapid response projects are intended for. Those, as said in the RFA, those need to be budgeted in the administrative core. The pilot projects, and this, there's more leeway for this because each center may develop their career enhancement activities differently, but this allows for some center-generated types of pilots connected with career enhancement activities. So I would recommend, even though it doesn't fit in the RFA, that you have to budget those within the career enhancement core. I would guess that reviewers, when they're looking at, you're going to be describing that pilot project program in that core, as according to the RFA. I would expect that it would make sense for the budget to be there. So hopefully that answers that question. Which is the next one?
Helen, I'm going to jump in and just clarify that the review process will be different. I think that was an element of that question.
Right.
So the review process for proposed rapid response projects and pilot projects will be different. So I would not recommend that you describe them together in the application.
That's a good point, Kate. The rapid response projects are going to be reviewed in conjunction with the FDA, NIH, and the steering committee. The pilot projects for career enhancement activities, each center, again, will have its own way of deciding on which projects they want to put forward. But stated in the RFA, those projects will still need to be vetted by NIH and CTP to make sure that they're still responsive to FDA regulatory authorities. Okay, so just in case you do not get to this information, please clarify page limits for sections. Is it 12 plus 1 for projects and 6 plus 1 for cores, where 1 plus 1 is a specific aims page, or is there no plus 1 for specific aims? No, it's 12 total. The 12 total. And I think there was another question related to the page limits. Apparently there's an error in the FAQ. Please, the page limits that are outlined in the RFA. So the overall is 12 pages. The project, so each research project gets 12, but the cores get 6. Total, not plus 1. Next question. Court rulings that relate to the type of product submitted for authorization affects the research question FDA wishes to explore. I'm going to turn that over to FDA to answer.
Okay. I don't know how to answer that question, honestly, without more information, because to be honest, I'm not really sure what the question is trying to ask. I mean, obviously, a lot of litigation that goes on around tobacco products, and so I'm just speaking generally, and, you know, I would just say it's a product that would meet our definition of a tobacco product and would therefore fall within our jurisdiction, regardless of kind of where things are at in a court proceeding. Until there is an actual court ruling, I would say it would fall within a product that we would be interested in studying, that would be relevant and appropriate for the RFA. And with any more information, I think that's all I can say.
Okay. Next question. How does FDA balance questions of toxicity versus population effects that relate to abuse liability?
I think, well, partly it depends on the pathway that the product would come in, and I did go through that quickly, meaning substantial equivalence, which obviously asks a different question. Does it raise a different question or a new question of public health versus prerequisite tobacco product application, which asks, is it appropriate for the protection of public health? So I think the answer is it depends. I mean, we look at all those aspects in total when we review a product application. And with more specificity in the question, I think that's all I can say, other than, you know, we have to, again, it depends on which mechanism or which pathway, and then, you know, it depends on the weight of the evidence in that product application when we're reviewing it.
Do characteristics for substantial equivalence include packaging?
Yes, so that's the short answer. Obviously, packaging of a tobacco product would be considered a component and characteristic. So, for example, you know, what material is in the packaging puts into the actual tobacco products that's used. So, packaging is considered of the tobacco product, and we review that. I'm not sure exactly where the question is, kind of what angle the question is coming from, but you know, when you look at marketing and labeling, as I mentioned in my talk, that's also something that we look at, and that could be on the packaging. I would just point to whoever asked the question that we did put out a guidance around frequently asked questions around SE, and that was the latest edition, which we've updated a couple of times. I want to say that's edition number 3 was just put out in December 2016, so you could look on our website for that, and it kind of talks about what changes constitute a new tobacco product. Would require SE to come in. So, for example, if you change the quantity, if you change from 20 cigarettes in a pack to like 3 cigarettes, I'm just making that up as an example, that's also considered a new tobacco product. So obviously that's a packaging question as well. So I would just point you to the SE guidance that's on our website. You could just Google probably FDA CTP SE guidance and find it. Google can find anything. I'm just saying.
Does budget raise any issues of funding for this RSA over this time period? Not very aware of.
Helen.
So, for PIs, for the overall TCORS, and also for each individual study, do all need to have current RO1?
Requirement of all.
Yeah, I don't think it's required. Oh, can everyone mute their mic? I'm hearing a lot of background papers moving around. So,
Is it because of the
we just turned the air conditioner back on because it was stifling hot in here, but I guess text us if it's interfering with your ability to hear the answers to these questions. New administration's priorities on cutting federal research and being anti-regulation is the cutting to the C-54 risk and the CTP risk. Again, same answer, not to our knowledge. FDA cleared the department, and as far as we are concerned, moving forward. In that we must set aside the $200K for rapid response projects. Does that mean each center will be assigned rapid response projects each year? If not, is the $200K then freed up for other center research? We're hoping that all of the centers will be able to use that money, but I would say in cases that if that doesn't happen, that there would be consideration for other ways to expend the funds. Or is that correct, Swan?
Well, I mean,
or it would have to go specific.
usually what is in the RFA, that's what we try and keep the money to. We don't want to have everyone, oh, I have $200,000. Let's now figure out a piece of equipment or something to buy with it. So no, we want them to try and keep to what the RFA, the purpose of the RFA.
An effort will be made to have that happen. There's a very big overlap between toxicity and health effects. For most people who are addressing one are automatically addressing the other. It's a given that addressing too many priorities is considered non-advantageous and may be combined. Well, you want to answer?
I would say that this is something for you to consider as you're framing your application. I would say to shy away from be included and making explicit that your research can include both. You're going to be the one framing your application to show that it is tightly focused and that you are proposing a program of research that is to be addressing the priorities that are set forth in the RFA. So we're not going to be counting it, you know, like a bean counter in essence. We're really going to be looking at the unitary proposal that you put forth. I wouldn't worry too much about can we combine it and call it one. I don't think that that would be advantageous. You can emphasize that you are looking primarily, say, at toxicology versus health effects and really call that your focus. Again, this would be something to discuss with the scientific and research context. I think that that's really a good place to start.
Yeah, I think it's better framing an integrated center with a logical focus. I mean, these categories are kind of arbitrary in the sense that there is a lot of overlap, right? I mean, what you could call one category versus the other, that's not the point. I think that Kay tried to make earlier about it not advantageous to address all or too many. It's just that you don't want to have a kitchen sink approach to your center. So that's really what that's intended to implement. So on all other NIH proposals, the page limitations apply to the research strategy component and does not include one-page specific document. Please confirm that the 6 page limits only applies to the research strategy.
So I can't give you that answer because in the face of 12 pages, there's nothing else. So at best I could double check with the department if they have any specific.
Yeah, we'll have to look into that. For now, I would say count on following the RFA, and if we information to the contrary, we will notify. Well, actually, I think if we find out anything to the contrary regarding that, we'll put a notice in the guide so that all investigators will be able to see they are given an additional page beyond what's listed in RFA. Single scientist serve as an investigator on more than one U54 application. Why not? There's no requirement that says they can't.
As long as it's not Castle and
right. In both Castle and TCORS are the personnel of the Castle can be the same investigators who are on TCORS. I mean, the idea here is that there's a level of objectivity and distance between the coordinating center and the TCORS. So that is stipulated in the RFA. However, if you're talking about someone wants to be on a U54 for one university and another, I don't think there's any restriction on that.
I just want them to be mindful of their effort, because when we're starting to look at these particular grants and see where they're starting to spread themselves, that's when we start to get concerned. So I just want everyone to be mindful of the effort that they're carrying on these large awards. They need to really be engaged.
Right. Is a contract or collaboration with a foreign entity that study a new tobacco to be reviewed by FDA and test market in their country, eligible for funding as a sub or a collaborator. In order to implement this question, so the subcontractor or collaboration with a foreign entity to study new tobacco products was expected to be reviewed by FDA and test market and eligible for.
Well, the question's actually maybe asking two things, and I think it's the first part that's probably the most relevant. I think you're just basically asking, you can have a subcontract with a foreign entity to do research in the TCORS, and I would say the answer is yes. And the second part, I think, is you're asking, well, the product matter? And I would just say, again, if the product is one that meets our definition, then the answer would be yes, because regardless of whether it would come, to mark in the U.S. or not, but I think the question is assuming that it is, then, but you need to understand that's why part RFA or the RFA is eligible to foreign entities, because we know that there is research in other countries that would be informative for in the U.S. So I think the answer is yes, and I'm not sure what the second question was, but if it's a product that meets our jurisdiction, that meets our regulatory authority, then I say yes.
Just really quick, just with foreign institutions by themselves are eligible for this. But foreign component, yes. And
I think that's what they were asking.
Oh my gosh, yes. So if they can just read the RFA, and in there it tells you, breaks it out for you exactly what the component is and what we'll accept.
In TCORS, how should progress be reported? How will it be used in the review process? You want me to answer?
So we try to discuss that question. No. So as you are within the limits of section, page 12 pages for project and 6 pages for course, you can describe the progress within that limits and will be evaluated as needed by the reviewer.
Basing your next project on results that you've got in the current TCORS. I mean, you could structure it like a preliminary study, preliminary results, but it still does need to stay within the page limits. More from the church. Do R&T-CORS have to go in as a renewal? If the TCORS is submitted as a renewal, do the title and aims have to be the same from no submission? So the answer to that is no. Do not. It is up to the innovators. You might want to talk to your program official about what you think would be more advantageous, whether you want it to be a renewal or whether you want it to be a new application. You can do either. I guess a lot depends on the productivity that you could demonstrate from your current TCORS and the directions that you think the research should be taken. The pre-funded TCORS, is it expected to have a section on progress accomplishments made during the funding cycle of the research plan? I think this is kind of left to your discretion in terms of how, in a case you can build. And if you have progress and a lot of productivity, I would want reviewers to know that. I don't think there's a set thing here. It's more of the case that you can make I want to switch to the questions that you we have I don't know, hopefully we'll get to all of these, but for questions that we don't address today, webinar.
We're also talking about the title. Part of the question was, can they change the name of the TCORS? Yeah. They're welcome to. Don't have, and actually, we would encourage you to change the title of your TCORS to something that's more descriptive or aligned with your integrative theme. I think that would be useful rather than calling it the X-University TCORS. Yeah, it might be, I would recommend that. But again, it's going to be up to you.
Okay, so here's another question. Will NIDA research cigarettes, e.g. Spectrum, be available for TCORS to research on a similar basis as currently? Mary, you want to answer that?
Yes, so yes, nicotine cigarettes will be available for TCORS 2.0. However, I should caution you that a new letter of authorization will be needed for your project. It is grant-specific and also institution-specific. With the newly formed letters of authorization, preparation and quantity requested will be explicitly stated in the letter of authorization. And also just checking with the drug supply program for inventory, making sure that we have enough inventory for your request. And working with myself or the FDA for new investigational tobacco product applications, because they are grant-specific and institution-specific, they may need to be updated as well. Yes, I'm Felicia Porter. I'm on the website. So if you just Google NIDA Drug Supply Program, I'm the first point of contact. And if you have any questions, just feel free to give me a call or email me.
Might it be possible to obtain other research tobacco products, for example, cigars, roll your own tobacco, or e-cigarettes, with no nicotine concentrations for use in TCORS 2.0 research projects? Yes, the answer to that is no.
How about the research e-cigarettes?
Yeah, I was going to say, the only thing, this is Kathy, aren't any other, I'm using air quotes, you can't see me, but, you know, research products other than the e-cigarettes that NIDA are working on. However, I should mention that we, FDA, have a cooperative agreement to manufacture reference cigarettes. You know, so those are for testing. It's not for human use, but those have the known constituents, you know, HPHCs, nicotine content. So those are available for testing, again, not human use. And then also we're working on a reference product for smokeless tobacco. So again, a reference product for testing, not for human use per se. But I'm not aware of other kind of research or reference products that are available beyond the ones we just mentioned.
Oh no, I just read that one. Will applications that propose to study products not yet available in the U.S. be considered responsive?
I think I kind of sort of answered that previously, meaning that if it meets the definition of a tobacco product and would fall within our jurisdiction, then I think that it's relevant and could be included as a product to be studied. I think that was what, if that's what I understood the question to be.
Yeah, and since Kathy's saying she thinks, this is one of those points where I would say I really strongly encourage you to contact a scientific contact from the RFA and have that discussion to make it explicit what you're thinking about, because it's not, there's make sure that your application is responsive, that it falls within FDA's regulatory authority, and there's also some, you know, it's also important to note that it should also be a priority. And when you're looking at products that aren't already marketed in the U.S., you need to, or if you're, you know, conducting research outside of the U.S. as well, you need to make sure that your research is relevant to U.S. product standards or potential U.S. actions. And so you're going to have to make that case in your application. So I would say this is really worth talking with a scientific research contact.
Right, and I can understand why whoever's asking the question doesn't want to specify the project, the product. So I think that's a really good point. If you can get more specific with program person and have a discussion about relevancy and priority.
The second part of that question, in particular, would an application that proposed to study heat not burn product that is already included in an MRTP application be considered responsive?
Again, for the reasons we've already talked about.
It states that short-term studies of the acute effects of reduced nicotine cigarettes are not required. What does RA consider short-term? Dana, are you going to answer that question?
Yeah, hi, this is Dana Van Dummel with Sun Tobacco Products. So I think that the thinking around or short-term was really look at what's already in our current research portfolio and then the research program. So most of that funding, if not all, I think, is through the Tobacco Regulatory Science Program or TRIST. So I'd encourage you to go to their website and look at what we're already funding around the research cigarettes. But currently, the majority of those projects are looking at short-term, so 6 to 8 week research projects, in-lab studies, looking at very specific populations, looking at short-term or immediate biomarkers and changes in biomarkers within that short window of time. I think that we're interested, I know that we're interested in looking beyond those studies, so that's why I highlighted what we weren't interested in this RFA in the hopes that folks could take it to the next step. Because we're interested in looking beyond that. Is it 6 months? Is it a year? I don't know that I know or anyone knows exactly what that would be, but we're interested in looking at behavior and use of research cigarettes, those low nicotine research cigarettes, beyond that short term.
Okay. If it sends an LOI early in May and obtains feedback that part of its off-target, non-responsive, can they resubmit a revised LOI? The answer is yes, but again, like Kay said, I encourage you sooner rather than later, talk to the appropriate scientific contact listed in the FOA to start getting feedback to see if you're on the right week. The RA is out now, folks, so we can give you feedback and are happy to do that.
This is Kay, and I'll also add that even if your LOI comes in on May 19th and you get feedback that it's not responsive, you aren't tied to what's in your LOI. You still can modify your proposal and your aims based on feedback that you get. So, not binding. The LOI is not binding.
This is a good question, actually. We offer pilot money for our postdocs, but also an RFA for others. It's been conducive to new ideas. Are we now restricted to only our postdocs and rapid response?
Career enhancement course, pilot projects aren't restricted to postdocs.
Right.
Remember, your career enhancement core, studies within your career enhancement core are meant to enhance the tobacco regulatory science expertise investigators across expertise. It could be pre-docs, postdocs, it could be fellows, early stage investigators, it could be more senior investigators who are retraining within tobacco regulatory science. So I would say it's not limited to a type of investigator.
And tell me if I'm wrong on this, I apologize if I cause confusion, but I think that the response aren't necessarily tied just to that TCORS, right? So the response topics and how that information is coming to the individual centers is different, but how you choose to award and respond to those is up to you. So you could, in having someone not directly affiliated with the TCORS who might be part of that,
A new collaborator.
And I would say that, with the current program, that these activities vary substantially from center to center, and how they're solicited, how they're reviewed, how topics are chosen, and who the awardees are. And there's still that flexibility here It's just that we are now also having more directed research through the response process. So hopefully that answers that question. In the Career Enhancement Corps are the two plans listed in the RSA, supervised research and career enhancement pilot projects, separately evaluated. I'm sure I understand.
Read it again.
In the Career Enhancement Corps are the two plans listed in the RSA, supervised research and career enhancement pilot projects separately evaluated. I'm wondering if they're confusing supervised research with rapid response.
Or if they're assuming that supervised research and pilot projects are two different things, and that.
Yeah, again, that it's up to the center to propose a career enhancement for structure. Centers seems.
And I would add this, that any new research that isn't already a component of, say, one of your 3 or more primary research projects or part of rapid response program, anytime you're proposing something new, it has to be approved by NIH and the FDA Center for Tobacco Products to ensure that it's responsive. And almost by default, that would be called a pilot project. So you can think of it that way. That thing that you're going to be proposing new would go through that pilot project approval process.
Next question, what view would FDA and NIH take of an application in which study product, for example, heat-not burn, was provided directly by a private tobacco company? Will that be perceived as creating a conflict of interest?
This is Kathy. I can't speak for NIH, but I'm going to pretend that I am not. I'm kidding. And make care, or Tawana, you want it to jump in. But my understanding of the COI at NIH is that question for NIH, and as anyone that gets a grant or a fund award from NIH, there is a conflict of interest process, and so that would be dealt with at time of award. I understand it's around, I believe there's a dollar limit, and I think it's $5,000, and it's around research objectivity, but that would be an assessment that NIH would have to make at time. So I think that's all I know that I can say. I don't know if Kara, Tawana, you had anything to add to that.
What was the limit?
I think it was $5,000, I thought. Maybe that's what I recall reading. I have read the NIH COI policy.
Yes.
But the is that if there is any potential conflict of interest, the investigator, it is incumbent on the investigator and the institution to report that to the NIH and to detail plans for mitigating the conflict of interest. Pretty without having the specifics, that's pretty much all we can tell you. That's the NIH policy.
And it is around having the person, the institution that gets the award, it's around research objectivity, so that's what the assessment is about.
And I would say that also that the reviewers see that. I mean, they're going to want to see that research is conducted in an objective manner. So there's some perception here, and it's kind of incumbent on you to find that. Our studies of acute topography affect second generation end responsive, i.e. first generation end topography studies are non-responsive.
Yes, this is Kathy again. I think the reason that we had what we weren't interested in as far as first generation products is that one, there's been quite a bit of research done on those products, and two, I think based on surveys and other research, we've seen people kind of move away from those products, and so having research more on the products that people are actually using, or much of the population, and again, that was part of my presentation, my point that one thing to say you're studying e-cigarettes, but it's useful to understand exactly what kinds of e-cigarettes and what kinds of populations, because again, having specificity is most informative to FDA. But the answer is yes, having topography on generations of e-cigarettes beyond first generation would be responsible.
Maybe one of the last questions. I was supposed to end at 4:30, I believe.
Yeah.
So additional statistical core is included in the proposal. Are the additional cores evaluated separately as a whole?
They evaluate it separately, and then it will be factored in the overall evaluation.
So yes, they will be evaluated separately and incorporated into the overall evaluation. So I think that's all we have time for. I know there were some other questions. We will get answers to those and post them on the AQ website. And again, if you don't feel your questions have been answered here today, please, and even if you do, we still encourage you to contact or the scientific contacts in the SLA to get answers to the questions. So thank you very much for your participation.
Thank you.
Thank you.